Welcome to our seminar today. My name is Paula Leonette, registered nurse. Today we have a video on Stroke 101. So today I hope to share with you very good and important information about stroke. I have some general information that I'd like to share with you. First of all, statistics. 700,000 people suffer from stroke every year. It is the leading cause of long-term disability in the United States. It is the third leading cause of mortality in the United States. And the sooner the treatment is initiated after onset of symptoms, the fewer the complications and higher level of functioning of the patient experiencing the stroke symptoms. So let's talk about what is a stroke. It's a brain attack. It's cutting off vital blood supply or blood flow and oxygen to the brain. The part of the brain that is supplied by the clotted blood vessel is then deprived of blood and oxygen. The cells of that part of the brain do die. In the United States, stroke is the third leading cause of death, killing 160,000 people each year and leading cause of adult disability. Let's talk about the causes of stroke. There are two kinds of stroke. There is a blockage and there is hemorrhage. So we're going to discuss those a little bit in detail. The blockage of an artery in the brain, it can be called a thrombosis or an embolism, and that's another word for clot. Basically, it means a clogging of the arteries in the brain. Hardening of the arteries leading to the brain, or an embolism, an actual clot that is in the brain that can come from the heart or another artery. This is called an ischemic stroke. The second type of stroke is a rupture, a hemorrhage. A cerebral hemorrhage or a brain hemorrhage is bleeding from the brain. Bleeding between the brain and the inside of the skull, also called a hemorrhagic stroke. Types of strokes, ischemic stroke, again, is the blood clot to the brain, and approximately 83% of all strokes are the ischemic stroke, the blood clot. The embolism stroke, or the ischemic stroke, occurs when a blood clot or a piece of plaque, cholesterol and calcium is what makes up a plaque, forms on the wall inside the heart and then breaks loose and travels through the open arteries and eventually lodges into an artery in the brain. Types of strokes, now we're going to talk a little bit about the hemorrhagic stroke, which isn't as common, and it's a weakened blood vessel that ruptures and then starts to leak blood into the brain. This accounts for approximately 17% of all strokes. Again, not as common as the other. The hemorrhagic stroke, however, is responsible for about 30% of all stroke deaths. If you've ever heard TIA, or transient ischemic attack, this also can be known as the mini stroke, or the warning sign to a stroke. It is very short-lived, sometimes less than 24 hours, and causes temporary impairment to the brain caused by a loss of blood supply temporarily. It causes a loss of function in the area of the body that is controlled by the affected portion of the brain. The loss of blood supply to the brain is most often caused by a clot that spontaneously forms in a blood vessel with the brain and then resolves itself. Again, it's commonly referred to as the mini stroke. Often a warning of an impending severe stroke or a permanent stroke usually occurs with a TIA or a transient ischemic attack, and of course we recommend it to be immediately evaluated by a physician. Let's talk about the risk factors, things we can control and things we can't. Risk factors that you can't control: being over 55, being male, being an African American, having diabetes, and having a family history of stroke. Again, these are all factors that we really have no control of. Things we can control: we can control high cholesterol, high blood pressure, heart disease, atrial fibrillation, and carotid artery disease. Other things that we can control that are risk factors for stroke would be smoking, being overweight, and drinking too much alcohol. Let's talk about the symptoms of a stroke. Sudden numbness or weakness of the face, arm, or leg, especially of one side of the body. The loss of voluntary movement and/or sensation may be complete or partial. And there may also be an associated tingling sensation in the affected area. Sudden confusion, trouble speaking, or understanding something. Sometimes weakness in the muscle of the face can cause drooling or even facial drooping. The smile may be off, it may be crooked. Sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, or balance or coordination changes. Sudden severe headache, also without a known cause for that headache. There is a test that we perform, especially in the emergency room or as paramedics arrive, are what we call the FAST test. The paramedics would look at the face and ask the person to smile. Does one side of the face droop? Then they look at the arms. Ask the person to raise both arms, and that's what a paramedic would do on the scene. Does one arm drift downward? Then there's speech. Ask the person to repeat a very simple sentence. Does the speech sound slurred or strange or confused? And then T stands for time, so we've spelled out the word FAST, F-A-S-T, face, arms, speech, and time. If you observe any of these signs, 911 must be called. As I said earlier in this presentation, the quicker we get medical help, the quicker we can get the treatment, and the stroke perhaps would be less debilitating than if we wait a while. So what should we do if we suspect someone having a stroke? Call 911. They should be taken to the hospital immediately. The doctor will take a history. Tests will be performed, including a CAT scan or an MRI of the brain, an angiogram, which is a picture of vessels, an ultrasound, and many blood tests. And how do we treat the CVA or the stroke? We use a medication called TPA. It is a powerful clot buster medication, but time is of the essence for TPA. We must treat this immediately. 90 minutes is about the maximum amount of time for the TPA to work appropriately and give it its best treatment action. The sooner the TPA is started, the better the outcome. Managing medical problems, we're going to manage low blood pressure. Many people that are having a stroke are also in a hypertensive situation. In other words, they have high blood pressure and sometimes very critically high blood pressure at the time. We need to control the diabetes. Many folks that have strokes would have diabetes in their history. Rehabilitation, physical therapy, occupational therapy, and speech therapy are also going to be very important with treatment and rehab. Effects of the stroke, right brain. Let's talk about the right brain for a minute. If the stroke occurs in the right side of the brain, the left side of the body will be affected, producing paralysis, vision problems, quick behavioral type problems, and memory loss. Left brain stroke, if the stroke would occur in the left side of the brain, the right side of the body would be affected. They would experience things like paralysis on the right side, speech or language problems, slow, cautious behavior, and memory loss. So let's talk about reducing our risk for stroke. How are we going to reduce that? How are we going to live without stroke? Control your blood pressure. High blood pressure is the leading cause of a stroke. Have your blood pressure checked at least once a year. Find out if you have atrial fibrillation. Atrial fibrillation can cause blood to collect in the chambers of the heart and form blood clots. These are the blood clots that can travel to the brain and cause the stroke. Your doctor can detect atrial fibrillation by checking your pulse. Stop smoking. Smoking doubles the risk of a stroke. If you drink alcohol, do so in moderation. Control your cholesterol. Control your diabetes. If you are a diabetic, follow all of your doctor's recommendations. And exercise. They say 30 minutes a day of exercise can improve your health in many, many ways and may reduce your risk for stroke. Enjoy a low salt, low sodium, lower fat diet. And treat circulation problems. Fatty deposits can block the arteries, which carry blood from your heart to your brain. So I hope you found today's seminar very informative. And if ever you think you are having symptoms or signs of a stroke, or you're with someone and you think they are experiencing those signs or symptoms, please seek medical attention immediately. Thank you for your attention and take care. This is Paula Leonette.